As many of you know, October is Breast Cancer Health Awareness Month. We've been seeing the pink all over town, and there's a lot of information coming at us on exactly what all that means. And obviously, we know breast cancer, and we all know somebody who probably has been diagnosed with breast cancer. But what you may not have known is in the last handful of years, some screening guidelines have changed. Some recommendations have shifted a little bit. And so we wanted to make sure that we brought you the most current guidelines, recommendations, what our friends and partners at UTMB Health are saying to us. Hi, I'm Megan Clanahan. I am the co-owner of Houston Moms. It is my privilege today to bring to you another important health topic. And obviously, again, we're talking about our breasts and boobs and all of the things. So if those words, maybe you're listening to this in the car. And if you have little ones, it depends, up to you. If you want to turn that down and come back to it later. But I have two experts joining us today. I have Dr. Crystal Alvarez. She's an OBGYN with UTMB Health. And then I have Dr. Angelica Robinson, and she is a breast cancer radiologist, or breast health radiologist, I think I should say. I'm going to let both of them introduce themselves and give them let them have a quick bio, and then we are going to get straight to the heart of what information you want to know. So, Dr. Alvarez, thank you so much for being here.
Thanks for having me. So I am Crystal Alvarez. I am an OB-GYN at UTMB. I practice at our Webster location and affiliated with the Clearlight campus. I've been an OB-GYN there since 2015 now, and I am a mom of two little ones, 9 and 6.
Woo. Okay, so busy mama. And we were just laughing earlier because we're like, she's actually like she's working today, y'all. So like she might have to like go touch
I
base.
am.
So she has someone covering, which is a great thing about UTMB Health. They're covering each other. So you're well taken
Yep,
care of. Um,
good team here.
so Dr. Alvarez, thank you so much for taking the time to talk about what we are going to get into today. And then I'm gonna hit it over to Dr. Robinson. Thank you so much for being here.
Thank you for having me. My name is Dr. Angelica Robinson. I am a breast imaging radiologist, as you noted. The easy way to say that is I'm a breast cancer doctor. I have been working with UTMB Health since 2011. My interesting fact is my first day as faculty at UTMB, I had 3 kids aged 3, 2, and newborn. That is my fun fact. So now that makes them, we go by grades, a 10th grade, 9th grade, 7th grade. So it is a very, very full life. I definitely think that of all the titles that I carry, the most important would be child of God, wife, and a mom, for sure.
No. Yes. And oh my gosh, you said like middle school. Mine are just now in seventh grade. I have twins. It's a whole world, my friend. It's a whole world.
On that whole world, we have the two that are in high school are in band. Did you know that the band seems to practice more than the football players? And I am not joking. I am being 100% serious.
Yeah, I have friends who are intimately involved in band, and our children unfortunately did not inherit any sort of musical gene at all. And so that's not our path. But I see the ones that are doing it and they're out there all the time. Like anytime I go to a football game to drop off my kid, the band is out there. So um incredible, and incredible for you ladies. It's always awesome to see medical professionals in this world, in this sphere, especially who get the mom thing and know how scary breast cancer and thinking about that can be. And so we really just want to not like spread any fear today, but let's just update people on what's happening in the world of breast cancer health, what we need to be aware of, and what ages we should start being aware, all that good stuff. And so, Dr. Alvarez, our resident OBGYN. So what role should you play or an OBGYN play in a patient's breast health kind of journey?
Yeah, so I think that as an OB-GYN, we're kind of like the front line to determining breast cancer screening, right? So when a patient comes and they come and see us for their annual well visit, we're trying to determine, is this patient, are they at an average risk of breast cancer, or are they our high risk population, which is going to need a little bit more, right? So we're going to be looking at our family history. Do you have any immediate family members that are affected with breast cancer, secondary relatives? And here at UTMB, we're lucky enough to have a cancer genetic counselor. And so when we start identifying these group of women that do have that strong family history, we're able to send them over to our genetic counselor for some testing, which is a great resource for us. There's other things that I'm looking at as well. So have they had previous abnormal imaging? Did they require biopsies before? What is their parity? Parity means like how many babies have you had? And did you have them later in life? Or did you have early periods, like early menarche, late menopause? Like how many of those risk factors? So when you come in for your wellness visit, I'm kind of looking through all of those things, and determining, are you our high risk patient? And if you are, we even have these tools that can tell us what's your lifetime risk of breast cancer, and should we be doing more? What that's gonna tell us how we're gonna screen you. Do we need increased surveillance? Then if you don't fall in that category, we put you in like our average risk breast cancer group. And I think with those patients, it's a lot of counseling, right? I think with all the new changes that are going on, it's a lot of shared decision making, right? So we're talking to the patients about, well, when do we start our clinical breast exams, and when do we start our screening, and what are the pros and cons of starting at different ages, right? Because there's different societies, and everybody has a difference of opinion as to when we should start these things and if we should be doing exams. And so we kind of have to have that discussion on the pros and cons of all of that.
So kind of speaking to those exams, it seems like there's been a shift a little bit, where we're doing like less self-home exams. Am I correct on saying this? Like, but maybe
Yeah,
like breast self-awareness? Because I guess the thing that I grew up with was like, every month you get in, you
right,
see up and you touch them and you see if you feel anything. Is that still accurate, or what is the new?
right, right. Yeah, so we've kind of steered away from these like routine self-examinations, right? And so you're right, like prior to like 2010 or so, we were telling everybody like every month you're going to do a breast exam and you're going to do it this way. And what we found when patients were doing that is that we weren't really getting much benefit from them. Like we weren't really improving our breast cancer detection. And if anything, maybe we were having like false positives, right? So people coming in that are saying like, I felt this, and what does that lead to? That leads to just more diagnostic testing or more procedures, sometimes some increased stress or anxiety regarding that while they're waiting for any diagnostic imaging. And so we ACOG, I'm going to speak for ACOG just because I'm an OB-GYN. So the American College of Obstetrics and Gynecology says it's more about breast awareness now. So know what's normal for your breast, know what it looks like, what it feels like, and look for changes. So you don't have to do the monthly exams like we used to, but know that if you were to feel something different on your breast, or you had skin changes or discharge or pain that's not going away, let's go in to be evaluated, because we want early detection, but we also don't want to do more procedures or more diagnostic testing. That's, like I said, doesn't we found that doesn't really have, we didn't find much benefit in doing that by having people do their monthly examinations.
I think that's so interesting because I remember I would just like always touch them and be like, I don't I don't know.
And that's a lot of women.
Because it's
Yes.
like it could be that time of the month or before that time of the month, and they feel different. And I'm like, well, that feels lumpier, but what am I actually feeling for? And I don't know. For my like sanity, I stopped. So I kind of came alongside y'all. I stopped doing like for
Yeah.
better or for worse. Which brings to the point that I am 43, Dr. Robinson. And how early should women start getting mammograms? What is the current recommendation now?
So, the current recommendations, and I'm going by the American College of Radiology, which a subset of that is the Society of Breast Imaging. The current recommendations are that for most women who have an average risk of breast cancer, they should start getting screening mammograms at the age of 40.
Okay.
So, other patients that have a higher risk, and by higher risk, these are patients who may come in to Dr. Alvarez's point saying, we've had quite a few people in our family who've had breast cancer, people who were diagnosed under the age of 40, my mom, my sister, so on and so forth. Those patients, they may benefit from screening mammography earlier than the age of 40, but no one starts before the age of 30. But the broad answer for most patients, starting mammograms every year at the age of 40 is what's recommended by the Society of Breast Imaging. There are the alternate guidelines. The United States Preventative Services Task Force, they have recently changed their guidelines saying they also agree with 40, but they're saying every other year. As a radiologist, please know that we're looking for changes. So when you're getting that exam every year, we're looking to see did anything change. So the more comparison we have, it's often very helpful for us as radiologists. And the SBI guidelines were based on randomized controlled trials. They looked at almost 500,000 women, and what they found is there was approximately a 26% reduction in mortality from women who start getting screening mammograms starting at the age of 40 and every year. So that's the science that is basing those guidelines.
That's a huge percentage. Wow. And super hopeful that if we're doing the right things and getting those screenings in and so we kind of hit on frequency there. What about people like me, who don't have a lot going on here, but it's very dense? I have very, very dense breast tissue. I mean, I have several friends who have that. What is, because I know what I've been told that I get to do and I've experienced it, but what's the recommendation there from a radiologist?
So for patients that have dense breasts, and what that means is the breast tissue, it's very conjoined together, and it's dense, meaning it's more whited out when we're looking. So looking through that breast tissue is a bit more complicated. We also know that women with dense breasts have a slightly increased risk of breast cancer, which makes sense because they have more breast tissue. So the recommendation for those patients, in addition to getting the mammogram, well, number one, we would recommend getting a 3D mammogram. The fancy word for that is tomosynthesis. So a 3D mammogram. Patients with dense breasts can also request to get additional imaging. That may be a surveillance ultrasound. So they
Mhm.
may get a mammogram and an ultrasound at the same time. Now, I do want to say most places do offer in the Houston area 3D mammogram, but I have been asked the question, well, what if I'm somewhere rural and they don't have 3D mammogram? That is fine as well. Just get a 2D, meaning not a 3D mammogram, if 3D is not offered, or perhaps there's a financial reason if it's not covered under insurance. A 2D mammogram is still much better than no mammogram.
Okay, great point. Like just whatever you can do, right? I've had those ultrasounds and I think people get scared of them and I think they're okay. Like if you've already had people down here, right, Dr. Alvarez, and you've had people here, it's just like just is another thing. Um, this is not necessarily on what we're going to cover, but I was thinking, Dr. Alvarez, obviously you have a lot of moms who are coming to you that's to see. What is your kind of like best advice if you're like, maybe you have a mom who's coming to you and she might be a high risk mama. Like, what are the words that you say as you kind of refer her out? I mean, the great thing that we love about UTMB Health is that y'all do have those like um genealogy where you can go and have that report done. You have a great system over in radiology where they're going to be taken care of. But what are the words that you say to mama?
Well, this is hard because, I tell them exactly everything you said. Like, listen, this is a great place to be. We have all the resources you need. Yes, you are high risk because of whatever the risk factor is. But also just some reassurance that, we're going to keep a close eye on this, right? So some of those moms, they need those increased surveillance, and we want to stay on top of it. I think that's the most important thing when you're high risk is that we are doing everything that we need to be doing for your screening. We are taking those extra steps, right? So sometimes they require, we say increased surveillance means like an MRI and a mammogram annually. So we're doing a little bit more, but it's to help them, reassure them that we're going to stay on top of this.
Yeah. And I think they need to hear that. And I think any time that we can do anything that feels really proactive as a mom, like we're like, okay, we're not just reacting to this. We're going to be proactive and like kind of have the control in the situation, right? Um, so here's kind of like a random I wasn't totally aware of this, but Dr. Robinson, I guess in 2021 there was some chatter when the COVID vaccines happened that you need to wait a bit before having your mammogram. Is that still a valid thing? What's happening with COVID vaccines and mammograms?
So, what we found is when patients were having the COVID vaccine, they were getting an immune response, which is normal. That's what we want. We want the immune system to spike up and to kick up in gear. What happened with that is sometimes the lymph nodes would become enlarged. So then, when a patient was coming in to get a mammogram, we were looking and the lymph nodes looked enlarged, and it was like, well, are they enlarged because there's something concerning going on, or are they enlarged from the COVID vaccine? So it took a bit of time to figure out, well, what's the best stance? And now what we're saying is that we don't want you to stop your screening mammogram based on the timing of your COVID vaccine. Now, you do need to let us know, I did get the COVID vaccine. And if it's within a time frame, ideally, yes, go ahead and come to us first and then get your COVID vaccine. But we don't want you to delay, because what we found is sometimes that what we call lymphadenopathy, the enlarged lymph nodes, they could take a while to get back to the normal size. So we don't want to hold off in that sense. So, if possible, if you can see us and then get your COVID vaccine, we'd appreciate it. But if you can't, if you just let us know, then we know most likely that lymph node enlargement we're seeing is just from the vaccine. We may then still say, just to be safe, let's bring you back in a few months, look again, just to make sure that that's going down. With that being said, if someone feels something under their arm and it's new, we can never assume, well, I'm sure that's just the vaccine. We would always need to look just to be careful.
Great advice there. I had no idea, honestly, y'all. And I think I turned 40 in 2022. So I had my no 2020. So then I had my first one in no my second one in 2021. I had no idea to tell them. Okay, so I'll be letting them know next time if I get my booster. So are there other things like COVID that would affect timing on when you want to do your mammogram? Are there better times of the month, the year to get that done?
I like to tell patients, so since we're recommending starting at 40 every year, sometimes it's good if you have a date, like you do it around your birthday, or you you do it every spring break. Otherwise it's very easy. As we all know, we're busy working moms, and for my moms that stay at home, you're busy as well. All moms are very busy. So it's easy to look up and think, wow, is it already been a year? Oh, it's been 2 years. Oh, wait, it's 3 years. And that is a frequent occurrence where we say, wow, we haven't seen you for 3 years. No, I was here, wasn't it? And it's like, no, it's been years. So I find if you have something, or you do it with friends every year, something that it will be memorable to you. And that's for screening mammography, meaning you don't have anything wrong. But if you are having an abnormality, meaning you feel something, or you're having pain, or you're having discharge, then you need to come in and see us. Even if you had just had normal imaging X amount of time before that, but now there's a change. So now we need to see you again.
Okay. Great tip there. I know a girlfriend who goes every year on her birthday, and then she goes and she has a margarita after. And, that's like her celebration. And I will say, I've been to y'all's facilities, at least one that does the mammographies, and y'all make it as comfortable as possible. It's like a little, like kind of a spa-like situation, and robes. And so you do make it less scary, and it's not bad, y'all. And it's like it's real quick. It's not bad. So I would say, Dr. Alvarez, any other like tips to give to maybe your patient who is like, I really just like, it's scary to me to go have a mammogram, like, whether it be maybe also they don't want to find out bad news if they have family history. What would you say to them?
I feel like I hear this all the time. Everybody is so worried about the pain from a mammogram or the results of a mammogram. But I just think it's so important for people to get this done. And really, the pain I feel like it's not very painful at all. And I think people hear from people, but I think from personal experience, I don't think it's bad at all. And so I always kind of give them that. Like it's really not all that bad, and it's better to find out early. And right, early detection is key. That's what's going to help. The survival of breast cancer is so much greater now, and it's because of this early detection. So we want to find out early. So we really don't want to put it off.
Great advice there. I know we have covered kind of like a plethora of new kind of guidelines and screenings and advice. Dr. Robinson, anything else that you would like to share with our audience?
I just want to remind your audience that to keep in mind that currently in the United States, there are over 3 million breast cancer survivors. Over 3 million. So breast cancer, there is, even for, the diagnosis, that's obviously, not necessarily what we want, but, even for those that have been diagnosed, there is hope. There is hope. There are many, many, many survivors. Many advances have been made in breast cancer detection. And as Dr. Alvarez mentioned, early detection is the key. So please don't hesitate. Please don't. I have patients when after they've left us and if they've gone through a cancer process, they say, no offense, Dr. Robinson, but I hope I don't have to see you again. And I say, I completely understand. So if you get your mammogram and just get a letter and don't see us, that means nothing is wrong and you just go on. If we call you back, often typically that is still nothing is necessarily wrong. It's still a very low percentage where something is wrong. And even for those, most survive.
That's such, hopeful information. I know we all are, as we're watching this video, have the handful of friends that you're thinking about right now who have gone through the journey. And so thankful that they have practitioners like y'all who are watching out for them, and, you know, truly giving them their best so they can get back to what they're best at, which is their mom life, right? Dr. Alvarez, Dr. Robinson, thank you so much for being with us today. you know, we do a lot of these videos during the year, and but you know, obviously October always hits hard for those of us with loved ones who have been there or are currently going through it. So we appreciate your expertise. For our Houston moms out there and Houston parents, I'm going to drop links to everything you need to know for how to find a breast cancer a doctor, a provider, a radiologist, like Dr. Robinson. If you need an OBGYN, you heard Dr. Alvarez say, that's the first line of defense right there, is to help kind of be able to determine your risk and kind of set you on that pathway. And so we can get you hooked up with providers just like these two ladies. Thank you so much for joining us, y'all.
Thank you.
Absolutely. Dr. Alvarez, thank you. I think she kind of had a
Thank
pause.
you.
Oh, there we go. Good old
There, I'm back.
It's so fun. And thank you for taking time away from your practice and delivering babies, both of you. Well, Dr. Robinson, you're not delivering babies, but you're doing very important things in the land of radiology. We appreciate y'all both so much. And y'all, next month we'll be back with another important health topic as we head into the holidays. Who can hardly believe it? But please stay aware. If this video at all encourages you to do anything, check that calendar, talk to your OBGYN, see if it's time for you to go get screened, or see if it's time to just have the conversation with your primary care or your OB. So you all take care and stay healthy, Houston, and we'll see you next time. Bye-bye.